Once the patient has been successfully intubated and proper position of the endotracheal tube has been confirmed with an X-ray, you will need to secure the tube to the patient so it does not dislodge, provide minimal tube movement when the head turns, and stay secure without creating any pressure points. One method, which we will be showing you today, is with the use of a NeoBar. We will take you through the preparation and application of securing the endotracheal tube to a neonatal patient using the NeoBar.
The following are indications for the use of NeoBars. NeoBars are a device used on patients such as neonates, infants, and children to stabilize and secure endotracheal tubes. The NeoBar comes in a variety of sizes with 2 tabs that will secure closely to the patient's ears and a small platform which the endotracheal tube will rest on. The bar allows the endotracheal tube to come straight out of the patient's mouth and prevents any pressure injury or skin breakdown from the endotracheal tube being taped anywhere directly around the patient's mouth.
Benefits and features: eliminates need for tape near nose or mouth, standardized application procedures and prevents frequent tape changes, color-coded sizes, skin-friendly hydrocolloid tabs, designed to reduce extubations, help prevent palate trauma, and allow for better oral care. Carefully cut the thin portion of NeoBar with blunt science at junction of bar and tab. Contraindications: for patients with infected or excoriated skin areas that will prevent from the proper placement of the tabs, not intended for adults. Skin irritation: do not use alcohol to clean skin prior to application. Oils and lotions adversely affect adhesion. Excessive salivation affecting the adhesion of the device. Separation of the plastic base from the adhesion pad, resulting in potential unintended endotracheal extubation. NeoBar should not contact lips.
Along with the NeoBar device, we will need the following equipment for endotracheal stabilization: sterile saline, 2x3 gauze, scissors. Next, we will prepare the tape that will be used to secure the endotracheal tube to the platform of the NeoBar. The tape should be cut about 4 to 5 inches in length. It is important when cutting the tape to keep a little extra at the ends, which we will fold over on each end into itself to create tabs. The tabs can be helpful during removal or in case of an emergency situation. You will need to select the appropriate size for the patient using the measuring tape included within each NeoBar. Place the strip midline from the patient's nasal septum right underneath their nose and wrap over to the ear. The appropriate size NeoBar will be the color that falls over the patient's ear canal. The color will correspond with the NeoBar size of the same color. Perform a quick fit check to confirm appropriate size for the face. Once you have confirmed the correct size, you will need to prep the patient's skin by cleaning the cheek area using a 2x3 gauze with sterile saline. Be sure to dry the skin completely because the hydrocolloid adhesive will not properly adhere to moist skin.
Application and taping. Before peeling off the plastic liner, the hydrocolloid adhesive tabs must be actively warmed to ensure best securement to the skin. Hold and warm the tabs between your hands for 60 seconds or place under a radiant warmer for 10 to 15 seconds. Peel and discard the plastic liners. Apply the hydrocolloid adhesive tabs in front of the ear on the cheekbones, ensuring the platform is centered above the lip in front of the ETT, and hold in place for 60 seconds to ensure proper adhesion. Ensure the ETT is below the platform to reduce pressure on the palate or gums, and begin to wrap the pre-cut tape once around the NeoBar. Then hold the ETT below the platform and wrap the tape around both the tube and the platform. Listen with a stethoscope over both sides of the chest to be sure the tube has not been displaced during taping. Assess the color change of the CO2 detector and watch for rise and fall of the chest with each assisted breath.
This section will discuss removal. Replace or remove the NeoBar every 5 days per hospital protocol. Using the pre-folded tabs on the tape used to secure the endotracheal tube to the NeoBar, unwrap the tape completely so that the endotracheal tube and NeoBar platform are completely separate. Saturate the tabs with sterile saline and slowly peel back the hydrocolloid adhesive tabs away from the skin as you swab with more sterile saline. Emergency removal. Carefully cut the thin portion of the NeoBar with blunt scissors at the junction of the bar and the tab. Remove both the endotracheal tube and pieces of the NeoBar and proceed with emergency intervention.